Okay. Any other questions? At the end of this lecture, everyone better say they want to be a pathologist, okay? Okay, so because it's Halloween season, we're going to switch gears and we're going to talk about a couple of scary cases. And we're going to talk about the unseen and the devil. I should have had some creepy music playing. Yeah. My wife saw this and she goes, "Oh my God." And I was like, yes, perfect. Okay, so we're going to go through two cases, two parts here. And the first one is titled, "This Will Make Your Skin Crawl." So our first patient, again, I'm going to show pictures that are kind of gross. So get ready, get ready. This is Bogsley. This is Bogsley. 12-year-old male neutered Shih Tzu mixed breed dog. And Bogsley presented, I'll show you pictures here, but with crusting and draining tracts and hemorrhage on his back, down his legs, on his neck, and then around his eyes as well. And it was kind of, there's pus around his eyes as well. He previously tested positive for blastomyces dermatitis, and that is, okay. That is blasto. Has anyone ever heard of blasto? Okay, cool. So it's a fungal disease, a systemic fungal disease that dogs can get. And so this dog tested positive for it, which is kind of weird, but they treated the dog and they thought he got better and got over it, basically. So last 2 times been to the clinic, had a fever of about 104 degrees. So he presented to the clinic and then came back a few days later, was not doing better. And it was really, really, really itchy at the same time. Okay, so in vet med, so you get this history. Okay, so think of this as like the stuff that your client is telling you in the room as well. And there's like these little like clues that you pick up as they're talking. Like they'll be like, "Well, I took him outside 3 times yesterday, and usually he goes 4." And that's the kind of stuff that you're like, okay, yeah, next. But what do you think are some of like the major things we might pull out of this? Like we call that the problem list of what's going on here and sort of how you look at the case. What are some things that stand out to you guys? Yeah, fever. Fever, got a fever, right? Okay, so fever usually means that there's some inflammation going on, usually systemic, pretty serious. And then that also raises our suspicion of maybe something infectious going on if there's a fever as well. So very good. Anything else? Yeah. Like you said. Yeah. Exactly. So he's got this crusting dermatitis going on here. And so that might be the reason that he's got the fever. It's just such severe inflammation. Anytime the body is, highly inflamed, you might have a fever going on there too. One of the other things is it's an older dog. And sometimes that like clues you in of like, younger dogs are affected by certain things. Older dogs are affected by other things. One of the things that older dogs are affected by is cancer. And so anytime I hear it's an older dog, that goes a little higher on the differential list for what I'm saying. This whole blasto thing is kind of weird and out of left field. I wasn't really sure what to think of this once I saw this case. But and then finally, moderately to markedly pruritic. What does pruritic mean? Itchy, good. So itchy. So I'm a weirdo that likes skin diseases. Itchiness is like one of the most common clinical signs we see with skin diseases in dogs. But when they say it's markedly itchy, I mean that's like the dog is just like digging at it and won't stop. You'll see allergic animals come into the clinic and the owner is like, "You need to do something because this dog just itches constantly. It keeps me up at night." You know that tag sound when your dog's like itching you, just constant throughout the night and they can't sleep. So those are kind of like the things we pull out of this. So the fever, the lesions that we're seeing on the dog, and I'll pull up the pictures of Bogsley here. So this is showing kind of his right flank there, and you can see that there's been hair loss there, and all that red fluid is hemorrhage, so blood that's coming from it. So these are open wounds. You can see some over here as well, and on the medial aspect of his front limb too. Here's showing those on his dorsum. So clinically speaking, this isn't just one area of the body. This is widespread about the dog, which again is kind of helpful when you're trying to figure out the case. They've clipped the dog's hair here showing that. So there's hair loss in some areas, but they've clipped it as well. And then this poor dog, he had all this crusting and hemorrhage around his eye. He looks really cute otherwise, but and then some hair loss here down by his nose. So they sent biopsies to me on this particular case, and this is what we found. Oh, yeah, I wanted to talk about. So different the differential diagnosis. Differential diagnosis meaning what are the possible things that we think of. So when we talk about differentials, we try to like organize that differential list of figuring out what's most likely and then what's least likely. And the way a clinician works through it is you basically take what's most likely and try to rule that in or out. And you do that with diagnostic tests. The nice thing with biopsies is you can rule a lot of things out at one time and maybe get a definitive diagnosis. But I look at this case, and because of the fever, I think infectious disease first and foremost. The alternative is that there's immune-mediated disease, and by that I mean there's no infectious agent, but the body's treating itself as the infectious agent. Does that make sense? So the body's attacking itself. It basically thinks that itself is a pathogen, and that does happen and cause skin disease in our veterinary species as well. But it's much, much, much less common than infectious diseases. So you put infectious highest on the list. And then neoplasia. The dog's 12 years old. Lymphoma sometimes presents as like a skin disease in dogs. And so given the fact that this dog was 12 years old, they had treated it previously with some medications and not had a really good response, made me wonder about neoplasia as well. So that's why it's nice to biopsy. So they send a biopsy off. That's how I get paid, you know. It's also what I like to do. So I'm not gonna I'm not gonna teach you guys histology right now. That's gonna be for first year of vet school. But what we're seeing here, these dilated things here, thingies, indicated by the convenient yellow circle there, are hair follicles. Okay, so they're hair follicles in the skin, and they're packed with a bunch of these little dit dots. You guys see those little dit dots in there? So if we zoom in a little more, we see these, and they're actually organisms that are within that hair follicle there. Okay, and if we look even closer, this is one of those organisms that's like laying on its side, like lounging. And he's got 4 pairs of, he's got an elongated body. He's got a head right there. He's got his tootsies. Okay. I make the vet students call them tootsies. So it has 4 pairs of jointed appendages. And that is really diagnostic for a particular type of mite. So this mite lives in hair follicles. Does anyone know which mite lives in the hair follicles of dogs? Yep. Demodex, fantastic. You're admitted. So this was this dog had widespread generalized Demodex infection. Okay. So Demodex is a obligate parasite of the canine hair follicles, and so commonly you'll see this present with a couple of things. First, alopecia, because basically the mites get in the hair follicle, and it basically jacks up the hair follicle, and the hair shaft falls out. Okay, so alopecia is one of the common things that we see with Demodex. It also causes inflammation in there, and that can cause alopecia and dermatitis. There's a localized and generalized form of it. Obviously, in this case, it was a generalized form for Bogsley. But the weird thing is that Bogsley is an older dog, and older dogs don't get generalized demodicosis. The immune response actually kind of suppresses it naturally. So that was kind of like the next level of like, okay, this might be Demodex, widespread Demodex, but why is a 12-year-old dog having widespread Demodex? So just thinking about what I told you there, what would be maybe a just big picture possibility for this dog and why he's got this widespread massive infection? What does it tell you about his immune response? Exactly. So his immune response is bad, and it turns out that they had tried treating him with steroids, and one of the things steroids do is it suppresses the immune response. So Bogsley had a suppressed immune response. As a result, he was unable to really fight off this Demodex. Now, the good thing is you can diagnose this, and the reason the clinician, not throwing them under the bus, but the reason the clinician didn't do a skin scrape on this case, usually skin scrape is like one of the first things you do with dermatitis, is because it was a 12-year-old dog. And they're like, why would a 12-year-old dog have Demodex? And sure enough, I mean, you could barely like squeeze the skin and get Demodex on there. So deep skin scrapes, those are the ones where you kind of like squeeze the skin and scrape at it in order to get the fluid. Anyone ever done skin scrapes? Yeah, they don't enjoy it. Yeah, yeah. But you have to really squeeze those hair follicles. Actually, it shoots the Demodex out. I just imagine them like on a water slide coming out. So here's some other photos showing Demodex, and the common feature here again is that they commonly present with alopecia or hair loss, as in these regions here, and showing what you see on cytology when you do those deep skin scrapes. You can see those guys and their 4 sets of tootsies there. I gotta stop saying that. Yeah, it's not professional, but I can't stop saying it. Now with generalized Demodex, up on the top there, we see it most commonly in puppies. We actually had a puppy today that had widespread demodicosis. And it can be really severe. So they can have like scarring as well from such severe infections, but usually it's associated with, like stray dogs and or dogs that have malnutrition. So the immune response in order to work well needs good nutrition. And so we see that quite frequently, but the dogs with treatment usually recover quite well. Sometimes they have areas where the hair doesn't come back though. So the chupacabra, anyone heard of the chupacabra before? How the hell did Jennings get to talk about chupacabra? Okay. So this is the legend of the chupacabra is actually based on a coyotes with, I have it come up there. Coyotes with sarcoptic mange. So sarcoptes is a different type of mange. So there's Demodex and sarcoptic mange in dogs. There's other types of mange. But when people were finding these carcasses of what they thought was chupacabra, it turns out that it was just coyotes with this really severe mange infection on it, which is pretty funny. I love the idea of all these old myths and where they came from, but it's sarcoptic mange. Okay, any questions on that, Kate? Yep. Quite commonly. Yeah, for sure. Yeah.
What was all of the pus on his eye? Was that from the scratching or was it from the actual?
Great question. So Demodex doesn't usually cause pus. So the chances are he was rubbing, scratching, damaged his skin, and or he probably had a secondary bacterial infection, which happens a lot. Secondary bacterial infections, we'll see that a lot with allergic disease in dogs too. So we call them hot spots. And the underlying issue was the Demodex, but he probably had the secondary. Yeah, good question. That's not something we typically see with just Demodex. Okay, kind of spooky, wasn't it? Give you the creepy crawlies. All right, and then part 2 is called The Death of the Devil. Okay, so this is a story about the Tasmanian devil. And the Tasmanian devil is the world's largest carnivorous marsupial. Does anyone know what the largest marsupial, just period, is? It's a red kangaroo, yeah. So kangaroo, but Tasmanian devils are awesome. They're really kind of interesting animals. They're endemic to Tasmania, and their behavior for mating is they have monogamous mating, and they have really vicious fighting between the males as a result. And because of that, they really like to have really sharp teeth. They'll get these facial wounds. And so this is going to circle back to why we're talking about this here. But if anyone didn't know, I mean, don't just nod your head and be like, I know where Tasmania is. How many people really knew where Tasmania is? So it's this little tiny island off the southern coast of Australia. I was hoping to go there if I actually did that talk, by the way. I want to see some Tasmanian devil. Okay, so they're kind of cute, right? Those little fingers, they're like they look like angry raccoons or something like that. And I'm not sure this is going to work. I'm going to give it a try, but you have to hear. This is the reason that they're called. Do you think sound's going to work? They're awful, aren't they? So the reason that they call them devils is because of this sound. So they used to hear these sounds in the bushes at night. Can you imagine walking out in the woods and hearing that at night? But that's where they got the devil from. They thought they were demons in the bushes, and they were actually these little animals. So back in the late 90s, and this was really interesting because while I was in vet school, they were really starting to learn more about this disease. They documented what they call devil facial tumor disease. Anyone heard of this before? Okay, a few people have heard of it. So it's a neoplastic disease. So it's a cancer of these Tasmanian devils that ended up resulting in and still continues to just absolutely decimate the population of these Tasmanian devils. So they're on this island. And what do we know about island genetics from Darwin, right? That they are oftentimes bottlenecked in there. And so as a result, they tend to be more susceptible to disease. Disease comes in, it can wipe out entire populations because their genetics have very little variation. So they're now considered endangered. They were widespread throughout the island, and now they're an endangered species there. And this devil facial tumor causes 100% mortality, meaning no one survives. None of them survive this particular tumor. So the question of why are all these animals, when they start seeing these masses on the face, I'm going to show some pictures here of it, but they started seeing these masses on the faces of these Tasmanian devils, and it was odd because you look at this and it's spreading between Tasmanian devils. What's your first thought when you see something spreading through a population? Just big picture. Yeah, it's contagious. It's something infectious, probably, right? And when the pathologists did histopathology on this, when they looked at it under the microscope, they said, this is a tumor. This is an inflammation. This is an infectious agent. It's a tumor. And so they studied it for a handful of years, trying to figure out what the heck was going on here. And what they ended up finding out is so interesting to me, that this is a transmissible cancer. So never heard of that before, basically the Tasmanian devil. I'll show you some other examples of it or mention these, but it's a transmissible cancer. We don't think of cancer as doing that, right? It affects the individual and that's it. That's how it develops. But what they found was they did research on the genetics of these tumors. What they found was that the animals on one side of the island had no chance of ever meeting the ones on the other side of the island, had the exact same genetics in their tumors. And what they came out of that is that, okay, this has to be the same exact process going on in each of those areas of the island. It turns out all of them were basically the exact same. And so the lesson from that was that even if it was something causing the cancer, the spontaneousness of the cancer developing on separate sides of the island would mean that they would have different genetics. It would look different. So they figured out that the genetics of the tumor cells differed greatly from that of the animals themselves. Okay, but when the males would fight, that was how this ended up being. They're very kind of aggressive. Even they're just like the Tasmanian devil culture, it's just very aggressive. They like biting each other. But as you can imagine, the biting actually transmits the tumor. So they break skin, and then one with the tumor cells kind of fall off into the wound of the other one, and it transmits the tumor from there, and then it kind of passes it on and passes it on. And because the genetics of the tumor differed greatly from that of the host, so two different Tasmanian devils, one has the tumor, gives it to the other one. The genetics are different between those. And usually what happens when you think about in medicine, if you take a piece of Jennings liver and try to give it to one of you out there in the, again, very dark examples here. If I give you an organ transplant, what's probably going to happen to that? It's going to reject it, right? Because our genetics don't match up. Your body recognizes that as something foreign, and it rejects it, and basically means it attacks it and kills the organ. So it takes a lot of effort in order to figure out, are two people compatible for organ transplants? And so the other odd thing happening here is, how the heck aren't these, if one animal is giving its tumor to another animal, why isn't that animal fighting it off with their immune response? It should reject that tumor. But that wasn't happening. So what it basically represented was that it was an allograft, what we call an allograft. So this is kind of showing the idea of immune tolerance. Tolerance meaning the immune system does not attack these tumors for some reason. Well, we actually know some of the reasons, but it doesn't attack these tumor cells. So if you were to take a dog here and give an organ transplant to a cat, we call that a xenograft. And that graft will last for a few hours before it's attacked by the immune response. Okay, if you do the same thing, if you take that dog's organ and give it to itself, it's not going to reject it. It has the same. We call that autografts. And then if you give it from one dog to another dog, we call that an allograft. So it's similar, but not exact same. And those sort of grafts will last for a some amount of time with that because they have close enough genetics that they don't completely reject the thing. And that seemed to be what was happening with these double facial tumors. So a lot of the research went into why so there's a lot of pathologists that were involved in this and still are to this day, because again, you know, there's a big concern that this will end up causing extinction of this species. And it's a big part of the system there. So why aren't the tumor cells killed by their immune response? So these neoplastic cells downregulate the very things that the immune system recognizes. And so in doing so, it prevents itself from being detected by the immune response, the double facial tumor, or by the double. So it feels weird calling an animal a double, but it's the name. What are you going to do? So what's happening basically is the tumor cells are hiding from the immune response, and so the animal will never be able to reject that particular tumor cell type. And so we think of the same thing in human cancer and in animal cancer as well. Is there's a lot of work at how we can turn the immune response against those cancer cells. And so that's what researchers have really looked at with this double facial tumor disease is how can we stimulate the immune response of these devils to reject these cancer cells. But so far they've been pretty stuck with how to do that. So there's really a lot of hope, one, that in natural selection, so there'll be a population of these devils that can recognize this and become resistant to it. And as a result, we can breed out that population and basically eliminate that disease or reduce the severity of the disease. So far, I don't believe they've had luck with identifying that. So as of right now, I think they're just crossing their fingers that can happen. The other thing is they're really looking at developing a vaccine for this. And so, you know, that whole idea of a vaccine is trying to stimulate the immune response towards something. And so they're looking at, can we develop a vaccine that stimulates the devil's immune response to attack those cells, in which case they can start vaccinating the whole population and then hopefully, you know, mitigating disease and more mortality with that too. Okay, so other infectious cancers. So believe it or not, this isn't the only one. Does anyone know there's one in dogs? We don't see it here very often at all, but does anyone know the tumor that's transmissible in dogs? We like never see it here. We have students that go to Ross down on the island, and so they see it all the time down there because it's common in the wild. Like they have stray dogs everywhere down on the island. So it is called the canine transmissible venereal tumor, and so kind of similar to the double facial tumor. It's transmissible during copulation, during mating. And as a result, they get those on the genitalia, and it's a transmissible tumor. So it's very similar to that. The good thing in dogs is that they'll eventually reject those tumor cells and cure themselves of the disease. So it's not fatal. It can cause limited disease, but the dogs will end up kind of mounting an immune response to that. There's also one in Syrian hamsters. It's called a contagious reticulum cell carcinoma that's transmitted by mosquitoes. So the cancer cells are transmitted by mosquitoes. Isn't that cool? Just say yes. Come on. And then soft shell clams, they have a leukemia that's transmissible between them. And the reason for that is they don't have MHC, which is basically the programming that helps reject grafts in these. Okay. With that, does anyone have any questions? I had a professor back in. His name was Tom Mulaney. I'm going to tell you. Sorry, I've got a couple extra minutes. I just want to tell stupid stories. Rambling Jennings here. One, the funny thing was he's Irish, and he had a really thick Irish accent. And one time I had to put his initials because I worked for him, and I had to put his initials and it was TPM. So his name was Thomas Mulaney, and it was his middle initial was P. And I said, "It's Patrick, isn't it?" And he goes, "Why would you think it's Patrick?" And I said, "Because you're super Irish." He goes, "You're absolutely right." Thomas Patrick Mulaney. But he used to do this thing where he would lecture. And so from the standpoint of teachers, it's really tough to like land exactly on the time and end your class right on time. Okay, so a lot of times you guys probably know that professors go long or they go short. But he would like nail it exactly to like the second of the end of class, and he would end it with like a perfect statement, like a hard statement that made you like. And so he would just end the lecture, and he'd be like, it's like supposed to end at 9:50, and it's like 9:40, 9:47, and he's like, and that's why if you figure that out, you'll save the patient, and you'll always save the patient. Have a good day. And I was like, oh my God. So I've always wanted to be like Dr. Mulaney, but it looks like I am about 4 minutes early, so I'll take more questions. Thank you guys for obliging me on this, both the discussion and the stupid stories. Thank you. Can I have one request? Can I take a selfie with the group? If anyone doesn't want to, just say it. It's not like I'm like blown up on social media. Yeah, I'll do it from this side here. I'll get it more. All right, thank you guys.
Do you guys leave around for like 5 minutes?
Sure.
Okay. Okay, before you leave, just 2 more things. Reminder to fill out the merch design poll if you haven't already. And then also Emily sent the charity Google form again, because I know we told you guys we donate a portion of the dues to charity. And we're trying to decide which charity to go with this year. So if you haven't voted in that Google form, it's in the GroupMe. So make sure to put your vote in for that. But otherwise, thank you guys so much for coming. Have a great week.